30 days. And here we are doing a rapid revision of all important questions, quick revision of volatile facts, and we are covering all the high-yielding topics in all subjects, and most expected questions in the university exams will also be covered. So this is beneficial for everyone from all the university exams of all the states. So here today, we will be covering some of the neuroanatomy topics, the long essays, short essays, as well as the short answers. You can use the code Dr. Divya 20 for the discount on the subscription. So before we go in for the classes, let us understand some core features of the Auricle for those who are new here. So we have here live classes as well as recorded classes. So recorded classes, you can access them anywhere, anytime. And we also offer you notes, which are CBME-based question answers, and there are MCQs also. And you can enjoy doing your self-assessment where there's a fun zone where you can solve the MCQs. And these MCQs are usually from the beginner level to the expert level, which are all standard multiple choice questions, which are asked in all the university exams. And you can use the code Dr. Divya 20 for the discount on subscription. So the subscription plans include basic, standard, and mentorship. Mentorship is a person program which we are offering for you at a special rate of 50,000. So in the features which are in other basic and standard programs are also here, including there is one-to-one personalized guidance as well as we offer you notes. So you can book a slot for personalized counseling session also on Auricle app. So we'll begin with today's class. So cerebellum. So we'll start with cerebellum. So there are important topics covered in the cerebellum, and cerebellum is most frequently asked questions in neuroanatomy in the university exams. So what is cerebellum? Cerebellum is the largest part of the hindbrain and second largest part of the brain. Okay, so where is it? It plays a major role in motor regulation as well as balance control. So where is it located? It is located in the posterior cranial fossa behind the pons and medulla. So from which it is separated by the cavity of the fourth ventricle. So relations, when we see anteriorly, there is fourth ventricle. Okay, so if you see here, this is cerebellum. Anteriorly, there is the fourth ventricle and pons and medulla. Posterior inferiorly, there is squamo-occipital, that is squamous part of the occipital bone. And superiorly, there is the dural fold, that is the tentorium cerebelli. The cerebellum, it consists of, so external features when we come to it, consists of two cerebellar hemispheres which are united to each other, okay, which are united by a vermis, median vermis. So it has two surfaces. Okay, the superior surface is slightly convex and the inferior slightly surface has a deep median notch called as vallicula, which separates the right and left convex hemispheres. So the lobes, it has three lobes, okay, anterior lobe, middle lobe, and the flocculonodular lobe. The middle lobe also called as the posterior lobe. We call it as the posterior lobe. In some books, they mention as middle lobe. That's correct. So anterior lobe, it lies in the anterior part. Okay, so on the superior, that is anterior part, and it is separated from the posterior or the middle lobe by the fissura prima. Okay, fissura prima will be on this surface here. So this blue thing, what you are seeing, will be the anterior lobe. That will be the fissura prima. The rest will be the middle of the posterior lobe. And it is largest of the three lobes and is situated on both the superior as well as inferior surface. Then we have flocculonodular lobe. It is the smallest lobe of the cerebellum. Okay, so it lies on the inferior surface between, here you can see, this is the flocculonodular lobe. Okay, in front of this is the posterolateral fissure. So there are many fissures. Okay, so there are many fissures on the cerebellar hemispheres. Okay, and when in a cross section, when we see, it looks like the tree with the leaves. Okay, so that is why it is called as arbor vitae, the cerebellum. So because arbor vitae means like the tree of life, okay, because most of the vital centers, they are controlled by the cerebellum. So horizontal fissure here, it separates the superior surface from the inferior surface, okay. That is all around it will be present. That is, it will separate the superior surface from the inferior surface. The primary fissure, it separates the anterior lobe from the middle lobe. Okay, primary fissure will separate the, so this is the primary fissure. It will separate the anterior lobe from the middle lobe or the posterior lobe, we can say. Then the posterolateral fissure is there here. So posterolateral fissure separates this middle part, okay, or the posterior lobe from the flocculonodular lobe, okay, posterolateral fissure. The vermis, the cerebellar hemispheres, they are united to each other through the vermis. So in the center, we see the vermis, okay. So these parts of the vermis, okay. Parts of the vermis with the respect to, so each of these anterior, posterior, and the flocculonodular lobe, no, they are related with the vermis. And the vermis in relation to each of that will have different parts, okay. So, and it will have some extensions into the cerebellum. There is the central portion of the hemisphere with this extension into the each lobe of the cerebellum. Okay, so now the parts of the vermis, which is in the center. To remember that, we can remember this mnemonic. Let the cats, you can remember it as catching, or you can also say it as, let the cats call dogs for the party up north. Okay. Or here it is given as like cats catching dogs for the party up north. So anyway, basically to remember this, so let cats call dogs for the party up north, okay, for the party up north. So L is, that is lingula, central lobule, then we have culmen, declive, folium, tuber, pyramid, uvula, and the nodule. So the lingula here doesn't have any extension. So lingula will be the most anterior part, and it doesn't have any extension into the cerebellar hemisphere. The central lobule extends as ala. The culmen, okay, the culmen, we call it as the quadrangular lobule. Then the declive is simple lobus simplex. Folium is superior semilunar lobule. So up to here, up to folium, it is on the superior surface, okay. So below will be the tuber. So tuber will be, that is on the inferior surface, we see tuber. So inferior semilunar lobule. Pyramid is biventral lobule. Uvula is tonsil. Nodule is flocculus. So they are the, okay, this is a MRI picture of these lobules. Okay. Next is morphological. Morphological division is very commonly asked. So morphological divisions of cerebellum are, we have three subdivisions, the archicerebellum, the paleocerebellum, and the neocerebellum. So archicerebellum is the most ancient, okay, it's the oldest. So here, the components include the flocculonodular lobe, both ends, okay. At the anterior end, it is the lingula, that is the central part of the first part of the vermis. And at the inferior end, it is the flocculonodular lobe, okay. So at either end, flocculonodular lobe plus lingula. So it has its own nuclei, which we call it as the nucleus fastigiae. And the chief connections here will be the vestibular cerebellar, okay, vestibular cerebellar tract that passes through this. The functions here, see, archicerebellum, we mainly see it in the fishes, okay, it is the oldest and we mainly see in the fishes. So in the fishes, it is basically when they are swimming in the water, they have to maintain the equilibrium. That is basically, it controls the truncal movement and maintain the, that is the main function there, okay, or that is the main requirement for the fishes there, right? So it maintains the equilibrium, which is responsible for maintaining the position of the body, okay. Then we have the paleocerebellum, okay. So paleocerebellum was the next evolved cerebellum. So it is between the archi and the neocerebellum. So this is all of the anterior lobe, okay. Anterior lobe, that is up to the primary fissure, except for the lingula. Lingula is it in the archicerebellum, right? So that is why there is no uvula, but there is the culmen and the central lobule with their extensions. Culmen extends as ala and central lobule as the quadrangular lobule. So that is the parts included here. So here the nucleus is nucleus interpositus, which consists of two nucleus globosus and nucleus emboliformis. Okay, nucleus globosus and emboliformis. So here the chief connections is spinocerebellar. So spinocerebellar, okay, so from the spinal cord to the cerebellum, whatever the tracks are coming, they come to this. Okay, and this control, so this we basically see in the birds, okay, birds and reptiles. So here they are responsible for maintaining the crude movements of the limbs, okay, and the tone of the muscles. So that is what it controls, paleocerebellum. Neocerebellum is the most recent and it includes the whole of the posterior lobe except the pyramid and the uvula. Okay, so here now, except lingula, pyramid and uvula is included in the paleocerebellum. Understand? So except pyramid and uvula, rest entire posterior lobe is included in the neocerebellum. Here the nucleus is nucleus dentatus. Okay. So the tract here we see is the cortico-pontocerebellar connection. And this is basically for, for the maintaining the, that is coordination, that is fine movements. Basically, we see this in mammals and humans, okay? So highly skilled movements, like the movements we do with our hands, the finger movements and all those things. For precision, we use the neocerebellum controls it. Then the functional division. So these, the entire cerebellum is divided into three zones, okay? Basically the lateral zone, intermediate zone, and the medial zone. So they are the functional divisions, okay? So the median zone, it belongs to the archicerebellum, okay, where we have the nucleus fastigi, okay? So basically the vestibulospinal, reticulospinal tract, they're all included there. So it controls the muscles of the limbs and controls the muscles of the trunk, neck, shoulders. Okay. Next, we have the intermediate zone. Intermediate zone, the tracts involved, intermediate zone, it belongs to the paleocerebellum. Okay, periocerebellum. So periocerebellum, we have the rubrospinal. So here the nucleus interpositus is there. And the lateral zone is basically the neocerebellum part. We have the dentato-rubrothalamic cortical tract, then descending corticospinal tract. Okay, so those tracts are involved there. So this is basically for the planning, programming, and coordination. Okay, so the finer, precise movements. So connections. So the cerebellum, okay, the ascending and descending tracts, whatever are coming to the cerebellum and going away from the cerebellum, that is efferent and efferent tracts, they come from different areas, okay, different parts of the brain, right? So this cerebellum is connected to the different parts by these peduncles, okay? So there is superior cerebellar peduncle, which connects the cerebellum to the midbrain. Then there is middle cerebellar peduncle, which connects it to the pons, and inferior connects it to the medulla oblongata, okay? So through these three peduncles, it is connected, and through these three peduncles, the efferent and efferent tracts go. So we can see here, the superior cerebellar peduncle connecting the cerebellum to midbrain. The afferent tracts include the anterior spinocerebellar and tectocerebellar. Okay, efferent is globorubral, then dentato-thalamic tract, okay, and fastigio-reticular tract. So these are efferent. Middle cerebellar. So middle cerebellar, you have to remember, it connects the cerebellum to pons. Here there are only afferent tracts. There is no efferent, okay? So pontocerebellar. Pontocerebellar belongs to that tract. Afferent tracts pass through middle cerebellar, and inferior cerebellar peduncle, it connects the cerebellum to the medulla oblongata. So here it includes posterior spinocerebellar, then cuneo-cerebellar, olivocerebellar, para-olivocerebellar, reticulocerebellar. Okay, so all this. Vestibulocerebellar, anterior external arcuate fibers, trimedullaris, trigeminocerebellar, all of them pass through this, okay, inferior cerebellar. peduncle, and efferent tracts here are fastigiovestibular, cerebellar-olivary, and fastigio-reticular. So gray matter of the cerebellum. Okay, so it consists of the cerebellar cortex and cerebellar nuclei. There are 4 pairs of nuclei. So one is nucleus dentatus. Okay, this is the nucleus dentatus. It is neocerebellum. Okay, so here if you see, the cerebellar cortex, okay, which we see it in histology, cerebellar cortex having 3 layers. The gray matter is concentrated there, and also in the central portion. The central portion, we call it as the deep cerebellar nuclei, and that includes the nucleus dentatus. Then we have nucleus globosus, okay, and emboliformis and nucleus fast. These two together, globose and the emboliformi, we call it as the nucleus interpositus, okay. Then blood supply of the cerebellum. So arterial supply, it is by a pair of superior cerebellar arteries, pair of anterior cerebellar, and a pair of posterior inferior cerebellar arteries, okay. So they basically come from the vertebrobasilar system. That is the vertebral arteries which join from basilar, right? So from there, the branches come. Venous drainage is carried by 2 main veins, that is the superior and inferior cerebellar veins, okay. So we'll try to understand a clinical case here. A 40-year-old female complained of inability to work properly with her right hand, and she would sway to right side while walking. She could not do rapid pronation and supination of her right forearm. MRI showed a tumor in the right lobe of cerebellum. Which cerebellar functions have been lost to give rise to the above symptoms? Okay. Okay. So here now. So this is like this, a case history will be asked. Okay. So we need to know. So she is not able to rapidly pronate and supinate, right? And she's swaying. So balance is lost, isn't it? So balance is lost. So as well as the coordination is lost here. The ratio of cerebellum to cerebrum in an adult is, how much is it? Okay. So cerebellum to cerebrum. Cerebrum is largest there. Cerebellum is smallest. Okay. So cerebrum to cerebellum, it comes to about 1:20. Purkinje cells are situated in where? Cerebral cortex junction Purkinje cells. Okay. Purkinje cells are situated here. Junction of molecular and granular layers. Okay. So here Purkinje cells, they are situated in the outer cortex, right? So cerebral cortex is a general answer there. It is actually situated there, but to be more precise, it is junction of molecular and granular cell layers. Okay. So between that, it is the second layer. There are 3 layers there. Second layer, which is a single cell layer. What is true about cerebellum? It is situated in the posterior pons. It is infratentorial structure that coordinates voluntary movements, and its structure is homotypical. So all of the above here. Which lobe is smallest in cerebellum? It is the floccular nodular lobe. Okay. Okay, we'll move on to this one. Diencephalon. So diencephalon is the middle structure embedded in the cerebrum. Okay, so it is the middle structure embedded in the cerebrum. So basically this belongs to the cerebrum. That is, we have the prosencephalon dividing into telencephalon as well as the diencephalon part, right? So this is the diencephalon part. So diencephalon is the middle structure there. So cavity formed here, the cavity which is formed is the third ventricle. Okay, so hypothalamic sulcus, it is extending from the interventricular foramen to the cerebral aqueduct. It divides each half of this diencephalon into dorsal and ventral parts. Okay, so this will be the dorsal part of it and this will be the ventral part of it. So the dorsal part of diencephalon consists of thalamus, metathalamus, and epithalamus. Okay, so thalamus here we have, and metathalamus includes the medial and lateral geniculate bodies, and epithalamus will be the pineal body and habelunar nucleus. Okay, so thalamus, a large mass of gray matter. Okay, a large mass of gray matter. So it is a large mass of gray matter which is about 4 centimeter each in transverse, vertical, and anterior-posterior diameters. So where is it situated? It is situated in the lateral wall of the third ventricle, as well as it forms the floor of central part of lateral ventricle. Okay, so it is situated there. It has two ends, an anterior end and a posterior end. Okay, anterior and posterior end. Then it has got superior, inferior, medial, and lateral surfaces. So the anterior end, okay, so anterior end, that is the of this thalamus, it forms the posterior boundary of the interventricular foramen. Posterior end is also called as pulvinar. So this pulvinar, it overhangs the lateral and medial geniculate bodies and the superior colliculus with this brachium. Brachium like the arm, no, it goes. So this is the lower part. Here we are not seeing it. Okay, so this forms a part of the midbrain. So superior surface is divided into a lateral ventricular part. Okay, and it forms the floor of the central part of lateral ventricle. Okay, so lateral ventricle is the cavity of the cerebrum, right? So this is situated below that. So it forms the floor. Okay, the extraventricular part is covered by tila choroidae of the third ventricle. And laterally, tila choroidae is basically, the pia mater which is innervated by the capillaries. Okay, so the capillaries with the pia mater, together we call it as the tila choroidae there. And laterally, there is a caudate nucleus, striae terminalis, and thalamostriate vein. Medially, there is habenula striae, and inferior surface has got thalamus and the hypothalamus. Medial surface is related to, it forms the posterior superior part of the lateral wall of the third ventricle, and lateral surface, forms the posterior limb of the internal capsule. So if you see here, this is the lateral ventricle, this is the thalamus. Okay, so this forms the superior surface, this was the lateral, this was the inferior, this was the medial, this was the lateral surface. Okay, and the ventricle will be, internal capsule will be situated here. So explain the structure and the nuclei of thalamus. Okay, so here, so basically it has white matter and the gray matter. So entire central nervous system has got white matter, gray matter, right? So what does this white matter contain? White matter contains external medullary lamina, okay? It has the external medullary lamina on the lateral, nearly to the lateral surface, and internal medullary lamina, which divides the thalamus into three parts, anterior, medial, and lateral. Okay, so you can see here, this is the external medullary lamina, and this is the internal medullary lamina, which is dividing into anterior, medial, and lateral. Okay, gray matter. So the anterior nucleus, if you see here, it is situated in the anterior part. Medial nucleus is situated in the medial part, and lateral part of the thalamus is largest here, and it represents the neothalamus. So it is divides. Okay. So this is divided into lateral nucleus and dorsolateral nucleus and ventral nucleus here, if you see. Okay, so the ventral nucleus is further subdivided into ventro-anterior, ventral-lateral, ventral-posterior-lateral. Okay, so these are the three things. And posterior group here will be divided into posterior-lateral, okay, or the dorsal and posterior-medial groups. Intralaminar nucleus means within the lamina here, we have the centromedian nucleus. Okay, so it will be situated within here. And midline nucleus, that is periventricular gray or periventricular gray matter on the medial surface, and reticular nuclei on the lateral surface is also present. So connections and functions of the thalamus. So it forms exteroceptive and proprioceptive impulses. Okay, so these exteroceptive and proprioceptive impulses, they ascend to it through the medial lemniscus, the spinothalamic tracts, and trigeminothalamic tracts. The visual and auditory impulses, they go to, okay, so basically exteroceptive, proprioceptive impulses, they are coming through all this, medial lemniscus, spinothalamic tract, and trigeminothalamic tract. Okay, so all these are formed in the medulla, right? And we see them. So visual and auditory impulses, they go to the medial and lateral geniculate bodies. So they pass through that. Sensations of taste, that is the solitariothalamic. Okay, so the nucleus, from the nucleus solitarius, it passes. And olfactory impulses pass through the thalamus to the amygdaloid complex. Visceral information, it goes to the reticular formation. And efferent projections, they also reach through this, it reaches the corpus striatum, hypothalamus, and reticular formation. So you can see the different pathway for this thing. What is that? Tracks passing through this to reach the different parts of the brain. Metathalamus. The metathalamus, it consists of medial and lateral geniculate bodies. It is situated on either side of the midbrain below the thalamus. Okay. So now medial geniculate body. Now what is this? It is situated below the pulvinar of the thalamus and lateral to the superior colliculus. So inferior brachium, it connects the medial geniculate body to inferior colliculus, and connections of medial geniculate body. Okay, so what are those connections? Connections are, we have lateral lemniscus, then there are fibers from both inferior colliculi, ascending reticular pathway, and perception of painful and nociceptive stimuli. Okay, so all these come to this. Okay, so the medial geniculate body. Efferents are acoustic, auditory radiation going to auditory area of the cortex, that is to the temporal lobe. It passes through the sublentiform part of the internal capsule. Then secondary somatosensory area. So the efferents from here, they go to these portions. So medial geniculate body is the last relay station on pathway of the auditory impulses to cerebral cortex and for perception of painful and nociceptive stimuli. Okay, so then lateral geniculate body. So it is a small oval elevation situated anterolateral to the medial geniculate body below the thalamus. So it is overlapped by the medial part of the temporal lobe and connected to superior colliculus by superior brachium. So this is basically a 6-layered structure. Okay, so if you see here, layers 1, 4, and 6, they are contralateral. These contralateral optic fibers come, whereas to the 2, 3, and 5, the same side, ipsilateral optic fibers come there. Okay, they relay there. Connections, afferents are optic tract. Okay, efferents, optic radiations. So from here, it goes to the optic radiations. The optic radiations begin there and they go to the occipital lobe, okay, visual area of the cortex, to the retrolentiform part of internal capsule. Functions here. Lateral geniculate body is the last relay station on visual pathway to the occipital cortex. Next is epithalamus. So epithalamus, it occupies the caudal part of the roof of diencephalon and consists of the right and left habenular nuclei situated beneath the floor of the corresponding habenular trigone. And it also consists of the pineal body or epiphysis cerebri, habenular commissure, and posterior commissure. Okay, so habenular commissure, it lies superior to the suprapineal recess, and posterior commissure, it lies below that, inferior to the suprapineal recess. So what is this habenular nucleus? So it is the nucleus. Basically, when we say nucleus, it is all collection of cell bodies, which is nothing but the gray matter. Okay, so it lies beneath the floor of the habenular trigone. Above, it is related to superior colliculus, and medially, it is related to the pulvinar of the thalamus. And medially, it is also bounded by the stria medullaris thalami and stalk of pineal body. Okay, so here in this portion, it will be there. And habenular nucleus forms a part of the limbic system. Afferents include afferents, they go to the hypothalamus, amygdaloid body, as well as to the hippocampus. Efferents, it comes to the interpeduncular nucleus. Functions, it acts as a nodal point for convergence of the basic emotional drives, okay? Pineal body, or it is also called pineal gland. It is a small conical organ projecting backwards and downwards between two superior colliculus. So it is placed between the splenium of the corpus callosum. Okay, so here you can see behind it will be in this region, pineal. Okay, and separated by tila choroidea of the third ventricle. Superior lamina of the stack. So what happens is it is like one small and one stalk goes up and one stalk comes down. Okay. So the superior lamina of the stalk contains the abenular commissure. Inferior will have the posterior commissure. Next, structure and function of the pineal body. So the pineal gland, it is composed of two types of cells. That is the pinealocytes and neuroglial cells. Sympathetic ganglion cells may also be present and it has no neural tissue in it. Okay, so it produces hormones that may have regulatory influence and many other endocrine organs like adenohypophysis, neurohypophysis, thyroid, parathyroid, adrenal cortex, and medulla and gonads. Okay, adrenal cortex and the adrenal medulla as well as to the gonads. So the important hormone is melatonin. Okay, melatonin. Melatonin, here it is not for skin color. Okay, so the hormone melatonin here basically it helps to control the circadian rhythm, okay, of the sleep and wakefulness. So basically it is a hormone. Melatonin is basically responsible to get good sleep. Okay. Ventral part of the encephalon. Here it has hypothalamus and subthalamus. So hypothalamus, its parts and connections. Okay, so what is hypothalamus? So hypothalamus is a part of the encephalon. As the name says, it lies below the thalamus. That's why it's called as hypothalamus. So it is in the floor and lateral wall of the third ventricle. It forms part of the floor as well as the lateral wall of third ventricle. So this hypothalamus, it is called as the head ganglion of autonomic nervous system. Why? Because it takes part in the control of many visceral as well as metabolic activities of the body. Okay, it includes, okay, it's already said. So in relation, it forms the floor of the third ventricle as well as the lateral wall of the third ventricle. Boundaries, anteriorly, it is bounded by the posterior perforated substance, and on each side, it has the optic tract and the crus cerebri. The sagittal section of the brain, anteriorly, there is, in the sagittal section, if you see here, there is lamina terminalis anteriorly. Inferiorly, there is the floor of the third ventricle. And posterior superiorly, there will be the hypothalamic sulcus. So it is divided into three parts: optic, tuberal. Okay, so this will be the optic part, the tuberal, and the mammillary parts behind. Okay, so the optic part will have three nuclei here: preoptic and supraoptic nuclei, paraventricular nuclei, okay, and suprachiasmatic nuclei above the optic chiasma. Okay. So here you can see this is the supraoptic, then the preoptic and paraventricular. The tuberal part will have ventromedial nucleus, dorsomedial nucleus, okay, and tuberal nucleus and arcuate nucleus in the floor of the third ventricle. Mammillary part will have posterior and lateral nucleus, okay, posterior nucleus which is situated caudal to the ventromedial and dorsomedial nuclei and the mammillary nucleus. Lateral nucleus, it is situated lateral to the posterior nucleus. Okay, so these nuclei, that is tuberal, arcuate, okay, are separated from the, that is basically the medial nucleus, they are separated from the lateral, okay, by the column of fornix, mammillothalamic tract, and the fasciculus retroflexus. Efferents. Efferents are supraoptic hypophyseal tract. From the optic nuclei, it goes to the pars posterior, pars tuberalis, and pars intermedia of the hypophysis cerebri. Okay, so supraoptic hypophyseal tract. So supraoptic hypophyseal tract, no? So basically these, see the it is connected to the pituitary gland here. Okay, so then we have the mammillothalamic tract. So mammillothalamic, mammallotegmental tract, and tuberoinfundibular tract. So coming to the functions of the hypothalamus, so it has an endocrine control. So endocrine control, what it does, how does it control? By forming the releasing hormones, okay? So thyrotropin, stimulating hormone, okay, corticotropin, this thing, hormone, okay, somatotropin, prolactin. So all these are either releasing or inhibiting hormones it forms, okay? So luteinizing hormone, follicle stimulating hormone, melanocyte stimulating hormone by the pars anterior of the hypophysis. Whereas posterior pituitary, what it does, posterior pituitary, you should remember, posterior pituitary does not produce the hormones. Instead, it stores the hormones, and the hormones are already coming from the hypothalamus. So oxytocin and vasopressin, okay? So they are the antidiuretic. Vasopressin is otherwise called as antidiuretic or ADH. They are secreted by the hypothalamus and they are brought to the pituitary, posterior pituitary. Then general autonomic effect. They are the anterior parts of hypothalamus parasympathetic activity. Posterior parts, they bring about sympathetic activity. Temperature regulation. So it raises the body, raised body temperature is decreased to vasodilatation, sweating, panting, and reduced heat production. Lowered, it is elevated by shivering, and in prolonged cases by hyperactivity of the thyroid. Then it regulation of food and water intake. Okay, so stimulation of the feeding center or damage of the satiety center causes hyperphagia leading to obesity. Stimulation of the satiety center, okay, or damage to that center, the damage of the feeding center causes hypophagia or even aphasia and death from starvation. So it also responsible for sexual behavior and reproduction, which is controlled by the anterior pituitary. Hypothalamus controls the gametogenesis. So it is also responsible for the reproductive cycles and the maturation and maintenance of secondary sexual characteristics. Okay, so it maintains the biological clock. Okay, so many tissues and organ systems of body show cyclical variation in the functional activity. So lesions of this anterior hypothalamus, it disturbs the rhythm of sleep and wakefulness. Okay, so this is where all the organs are situated and what hormones are secreted. So as to have a pictorial representation of that thyroid gland. Then we have the hypothalamus producing all the hormones. Here we have below that pituitary gland, which has these hormones, and pineal gland, which is producing the melatonin. Okay. Subthalamus. So subthalamus lies between the midbrain and the thalamus. Medial, and it lies medial to the internal capsule and the globus pallidus. It consists, now the gray matter here of the subthalamus consists of the cranial ends of the red nucleus and substantia nigra extends into it. Okay, so red nucleus and substantia nigra, both you see it in the midbrain. Also, it has got subthalamic nucleus and zona incerta. Okay. Neuroanatomy, certain terms are a little difficult to remember, but once you understand it and know a pictorial representation of it, it becomes a little easier. White matter, the cranial ends of the lemnisci. Okay, so white matter is mainly consists of the cranial ends of the lemnisci lateral to the red nucleus, dentatothalamic tract along with the rubrothalamic fibers, ansa lenticulari, fasciculus lenticularis, subthalamic fasciculus, and subthalamic nucleus is situated dorsolateral to the red nucleus and ventral to zona incerta. Now, zona incerta is a thin lamina of gray matter situated between the thalamus and the subthalamic nucleus. Laterally, it consists of the reticular nucleus of the thalamus. Okay, and the activity influences drinking of water. Basal ganglia. Now, the basal ganglia, they are large masses of gray matter situated within each cerebral hemisphere. So it forms the essential part of the extrapyramidal system. Okay. So it consists of corpus striatum, claustrum, amygdaloid body, substantia nigra, red nucleus, and the subthalamus. Okay, so you can see here, this is the amygdaloid nucleus, this is the caudate nucleus, this is the globus pallidus, putamen, and lateral geniculate body situated. This is the optic tract. Corpus striatum, caudate and lentiform nucleus are divided by the internal capsule. Okay, but at the anterior end, the caudate and the lentiform nucleus, they will be interconnected by the gray matter running across the internal capsule. So that is why it is called as corpus striatum. Okay, so that is that, corpus striatum. So lentiform nucleus, now here if you see, okay, so let's just enlarge the diagram so you can see it further. So this is the internal capsule. This is the head of the caudate nucleus. This is what we said why it is connected. Okay, this is the lentiform nucleus. Okay, so this is further divided into putamen. Okay, this is the putamen and globus pallidus by the external medullary lamina. Okay, and globus pallidus is further divided into external internal part by the internal medullary lamina. This is the internal medullary lamina. Caudate nucleus. It is a large comma-shaped gray matter. It surrounds the thalamus and itself is surrounded by the lateral ventricle. It has three parts. Anterior to posterior, if you see, it has the head, the body, and the tail portion. The head is large and rounded and forms, okay, it is large and rounded, forms floor and lateral wall of the anterior horn of the lateral ventricle. Body, it continues from the head and forms the floor of this. So if you see here, here will be the lateral ventricle. It forms the floor of the central part of the lateral ventricle and it is related to the thalamus. Okay, medially from which it is separated by the thalamostriate vein and striatum terminalis. Tail is, it winds around the thalamus in the lower part here and enters the temporal lobe. It forms the roof of the inferior horn of the lateral ventricle and it ends anteriorly in the amygdaloid body. Okay, at the end it has amygdaloid body. Okay, so next is lentiform nucleus. So it is a lentiform nucleus is a biconvex gray matter situated medial to the insula. Okay, so basically this insula is a hidden lobe. Okay, it is also called as real silence. So it is the hidden lobe. So it is a small region. Okay, so if we open that portion of the temporal lobe, the frontal lobe, and the parietal lobe, if we retract it, we can see this insula. So it is seen deep within the lateral sulcus there. Okay. So it is a wedge shape. This lentiform nucleus is wedge shape in cross section with a broad convex surface facing laterally. It is divided into two parts by the external medullary lamina. Medially, it has globus pallidus. Laterally, there is putamen. Okay. So here, so this is what? This is the globus pallidus and laterally, this is the lentiform nucleus. So medially, there is globus pallidus and laterally, there is putamen. Globus pallidus, here you can see. Yeah. So globus pallidus is further divided into inner and outer segment by the internal medullary lamina. Next is claustrum. This is the claustrum outside here. So claustrum is a thin strip of gray matter lying between the insula and the lentiform nucleus. Okay. It is separated from the lentiform nucleus by the external capsule. And the function of this is not known. Okay, it's not exactly known what is the function. Next, we have amygdaloid body. Amygdaloid body is a small rounded gray matter present in the roof of the inferior horn of the lateral ventricle at the anterior end of the caudate nucleus. So this belongs to the limbic system. It is responsible for visceral responses to stimuli due to environmental changes. Okay, so that is why amygdaloid body, it is considered as like our primitive brain, like, basically it is like a protective part. It always is very sensitive to the visual stimulus, like environment. It always senses any danger, okay, in the environment, amygdaloid body. So subthalamus, it is a small nucleus lying caudal to the lateral half of the thalamus and inferior-medial to the globus pallidus. So it has reciprocal connections with globus pallidus via the subthalamic fasciculus and coordinates the normal smooth movement of various parts of the body. So what are the connections of basal ganglia? So all inputs, okay, are received by the caudate nucleus and the putamen. Efferents are given from these, okay, that is caudate nucleus and putamen to the globus pallidus. And output from the globus pallidus is projected to outer centers, other centers. So afferent connections are corticostriate, thalamostriate, nigrostriate, and reticulostriate and ceruleostriate. So you can see here, it all goes to these. Efferent connections, okay, so you can see globus pallidus, okay, so from subthalamic fasciculus to subthalamus, ansa lenticularis to thalamus, ventroanterior and ventrolateral nuclei, and as well as to pallidonigral and fasciculus lenticularis, it goes to this one, that is the thalamus, and pallidonigral, it goes to the substantia nigra. Okay. Okay, so we go to functions. So functions of the basal ganglia include planning and programming of voluntary movements. Besides the range, power, and speed of movements, it decreases the muscle tone and prevents any involuntary movements. Okay, so functions, and it also includes, it controls automated associated movements, controls reflex muscular activity and group of movements for emotional expression, fixes the proximal joints in appropriate position so that the distal joints could act with maximum advantage. Okay, so now if you want to only move the wrist, the other joints, okay, so if we have to move only the wrist, these joints should be stable, the elbow or the shoulder joint, right? So like that it moves, all the interphalangeal joints should be moved only if you want to move the wrist. Okay, so that is what it means. It fixes the proximal joint in appropriate positions. Okay. So lesions of basal ganglia. One is the Parkinson's disease. Okay, so Parkinson's disease. So basically here, the lesion is in the striatonigral and nigrostriate pathway is affected here. So it is basically because of the deficiency of dopamine. Okay, so there is loss of inhibitory control of corpus striatum, that is activity by the substantia nigra. So because of that, what happens? There are a lot of involuntary movements, okay, including tremors. So symptoms of Parkinson's patients, what happens? Okay, so basically here, there is a deficiency of dopamine. Okay, so because of the disease there, lesion there, it results in decreased production of dopamine. So dopamine is responsible for the suppression, okay, of any involuntary movement. So because of that, there are resting tremors, loss of emotional expression, absence of automated associated movements. Okay, so when they just simply keep rolling, like, the pill rolling tremors and cogwheel rigidity. When they try to move their limbs, they have that kind of cogwheel rigidity. Athetosis. Athetosis is slow, sinuous, writhing movements of the distal portion of the limbs. It is due to lesion in the neostriatum and globus pallidus, which leads to breaking of their cortical connection. So basically, it's like athetosis, they keep like, involuntary movements. It looks like as if they are always dancing, dancing motion, okay? And balismus. So balismus here, it is violent burst of irregular movements of trunk, girdles, and the proximal extremities, okay? That is pelvic and pectoral girdles, trunk, and the proximal extremities. This is basically due to vascular lesion in the subthalamic nucleus. So all are components of basal ganglia except, okay, so thalamus, amygdaloid nucleus, substantia nigra, globus pallidus. So here thalamus is not included. Nucleus of basal ganglia include the caudate nucleus. Which of the following clearly states the role of basal ganglia and motor function? Okay, so what does it do? Basal ganglia. Basal ganglia is responsible for the skill function. Globus pallidus putamen are present in the basal ganglia. An incorrect matching pair about basal ganglia lesion. Okay, so atetosis. Can you recollect? Atetosis is globus pallidus. Incorrect matching pair. Incorrect matching pair. Okay, Wilson's. Anterior limit of forebrain is represented by, okay, lamina terminalis. Broca's area is located in the frontal lobe. All of the following are parts of basal ganglia except the thalamus, okay. Which of the following structures related to auditory pathway? It is trapezoid. Okay. So with this, we complete today's class. So thanks for watching Auricle. For more content, you can follow our social media handles on YouTube, Instagram, Facebook, and Telegram. And those who are new, you can download the app now, which you can get it on Google Play and App Store. And you can start your journey with Auricle towards achieving better results. So until then, next time.